you start building up in calling back the libido that you feel that you lost, because that myth that libido and sex is like high heels, you leave them behind after your 30s. It's not true. It should be as fun and as accessible at our age right now as it was when we were younger. And our libido and our sexual desire are not there only for reproduction. They're as part of our well-being and our good mindset.
Welcome to the Double Down podcast with Dr. D. I'm Dr. Paola D'Aleman, a triple board certified MD with a passion for helping you thrive at every stage of life, from your first steps into wellness to navigating menopause like a pro. Whether you're tackling weight, mastering menopause, or leveling up your health, this is your go-to space for transformation. It's time to double down on your health and your life. Let's get started.
Hello, and welcome again to Double Down with Dr. D podcast. Menopause has the intention to regain all the beauty in midlife and the perimenopause transition. I am Paola D'Aleman, Dr. D, triple board certified physician, a Latina woman going through perimenopause, a big defender of what is right, and a big believer that self-care is a priority. On our first episode, we went a little bit through the history on how we lost a little bit our independence and our freedom into a patriarchal type of society, kind of criticize our very well-known psychotherapist Sigmund Freud for calling us neurotic and emotionally unstable. And I brought to the picture the pharmaceutical companies because they saw the opportunity to put in the market the fixing for our lack of / declining in hormones moment in life, which I believe it can be a very good business because it's like 51% of society, all women, that is something that we cannot escape from, and it is perimenopause and menopause. But today, on our process of getting creative and regaining our spark, we're going to talk about sexual health. I wanted to give you a full story on hormones, on how they work in our body, and this is going to be part of that, but let's go per system. To make it a little spicy, let's start with our sexual health. So hormones and your sexual health and how to reclaim the spark in our sexual life, which on the other side, it has a lot to do with our right brain and creativity and being playful and imagination. So in my practice, I see a lot of women whose first complaint it is, I do not feel myself. And I do not feel myself comes with, I am not the sexy mama that I used to be 10, 20 years ago. So of course, sexual health is playing a big part on how hormones start changing in our bodies and how the levels of estrogen start going down. So our reproductive system relies on estrogen for ovulation, and obviously that has the purpose of reproduction. And it doesn't stop there. Estrogens and its receptors are located in all the different organs all over our body. And one of the most important organs, obviously, is our genital and urinary system. So our vagina, our vulva, and obviously our urethra, our bladder, and those receptors are essential for a good function. Incontinence, vaginal dryness, pain with sex, all this is part of what we call genital urinary syndrome of the menopause. And it is directly related to how much estrogens we have in that area. So the fact that we don't produce as much as before brings us to all these symptoms that can be very uncomfortable. But like Dr. Marie Claire said, it's inevitable to go through menopause, but it's optional if we have suffered through the pain. To start with, how to fix some of these symptoms or how to diminish the feeling of these symptoms, let's start understanding the connection of mind and body. So for this specific talk, we're going to concentrate on your brain, which includes your mind. And FYI, there is a lot of estrogen receptors in your brain. And we're going to talk about our vaginal mucosa and the pelvic floor. All these organs depend on our hormones. Perimenopause, because during perimenopause, the hormones are like a Wi-Fi. Sometimes they are reliable, sometimes they are not reliable. Sometimes they are present, sometimes you don't have any signal. And so this is when you go to the ups and downs, ups and downs. Actually, something very alike is felt during the menarche years, when the menarche relates to the first periods, when puberty arrives and the teenagers are going through irregular periods and the hormones fluctuate. So if you have teenagers at home, you know what I'm talking about, or if you were one of those teenagers, you know what I'm talking about. Unreliable at the beginning and at the end. Once we are through regular periods and we have the exact hormones that we need daily, same at menopause. Afterwards, we're postmenopausal, we arrive to a more balanced state. We're going to have less of those periods. Your body, it is not broken. It is just remodeling. And modern medicine has a lot to help on that remodeling. So the same way that it is your house and you bring over a contractor, and the contractor brings over each of their workers, we look at what they're doing in our house. We know exactly how we want that kitchen to look like, but we're gonna let the contractor to give us their best advice on how to arrive to what we envision. Same it is when we want to fix any specific symptom that it is bothering us. So for a vaginal dryness, there is what we call hormonal replacement, or we have medications that they are hormone-based, and we have non-hormonal. And because the brain is involved, we also have supportive behavioral therapy. All together can bring us back to a perfect state to heat up things again and to ignite this flame again within us. And that's going to help a lot, especially if you are already in a relationship, or it can be already in a relationship of many years, or maybe you're starting to date, or maybe even you don't feel like dating. There is still sexual health that is related to yourself only. So putting back that vaginal mucosa into a more moist, juicy state, and creating a perfect environment of a muscular environment, which is your pelvic floor. And through this series, you're going to hear from me a lot about our system, the muscles in general, which are absolutely important and necessary to support us through these next stages. So muscle eating, one of the organs that is going to get our attention, those pelvic floor muscles, they're going to pass unnoticed. So there is such a thing as exercising for your pelvic floor, and we can talk about it later about that. For vaginal mucosa wellness, the bacteria flora, normal flora that the vaginal contains is very, very important. I'm a big believer on probiotics, and there is a lot of food that are already rich in probiotics. And if you decide to go for a supplement of probiotics, just always make sure that you are dealing with the right lab and the right strain. So there is different bacteria that they live in your vaginal mucosa. There is different bacteria that they live in your colon. Every strain has a different purpose. So in these circumstances is vaginal mucosa health. So you can find them in the typical lactobacillus and bacteroids that they are in yogurt or in dairy. But if you are not taking any dairy, any supplement that carries those strains are fine. There is actually some labs who put together the right strains under like women's health type of probiotics supplements. The next is moisturizers. So vaginal moisturizers, hyaluronic acid, it's a good option as well, and other moisturizers over the counter that will ease intercourse, especially. And then we have the hormonal support, which is, it can be locally, which is our vaginal tablets or creams or gels or inserts. There is a ring that is very practical because the ring, it will be just replaced every 3 weeks. So that's a possibility to estrogenize inside the vagina, which is going to diminish any feeling of dryness, pain, and is going to be in general healthier. To improve our pelvic floor muscle function, which is absolutely essential not only for sexual health but for bladder control and overall well-being, we have many options, from starting with breathing exercises and very mindful exercises that are directed to that area, to the Kegel exercises, the reverse Kegel exercises. There's physical therapy specialized for pelvic floor. And we have certain technology and certain equipment like the chair, EMS, which is a stimulant of the muscle, like a electric muscle stimulant. We have laser. Vaginal laser is something new in the market that is still under research, but is showing some improvement on plasma injections on the area. Mindful breathing exercises, Pilates, yoga are things that we can do every day, either to improve it or to treat it, our pelvic floor function. So those are tips that I can give you just to make that area strong and stay healthy and responsive. Because we go to the gym and we lift weights and we just focus on our upper body, lower body, and core, and nobody thinks about the perineum, which is that area with all these muscles that they are in the inside, so you don't see them, and you only feel them when you are about to go to the bathroom and you are just holding on not having micturition before arriving to the toilet, or even on your encopresis, which is like when you cannot hold on with number 2. So that area is essential, and most of women, we have a little bit of weakness on those muscles because if we were pregnant and we bear babies, and especially if we gave birth to babies vaginally, those muscles tend to be very lax. And if you never were pregnant, you still are losing your estrogens after 35. If you're now in your 40s and perimenopause, many of those muscles are very rich in estrogen receptors, to the point that when we use vaginal tablets for moisturizing the vaginal mucosa, many women respond positively to incontinence. So the bladder responds and the muscles around the bladder for a good continence to hold on non-planned micturition. Now let's talk about ways to rekindle that sexual desire beyond sexy lingerie, which always helps. But since I said it from the beginning, the brain and the mind plays a very important role in your sexual health. It is where you put your mind. And let's take again that skill and that advantage where we are right now in life, wiser and calmer. And with some mindfulness and some meditation, we could put our mind at ease, put stress on the side, because stress is a killer of imagination and creativity. And imagination and creativity is almost the foundation for a fun, healthy sexual interaction. As a lifestyle medicine doctor, I have to tell you, let's prioritize yourself, self-care. If you are good, if you are well, if you feel good in your body, in your skin, you're in a good mental health, a good mindset, and you can have a good communication with your partner, or maybe you don't need a partner to have a healthy sexual life. You start from a healthy point. And I forgot to mention sleep. Insomnia has been proven that one of the first things that influences it's a poor desire, low libido, and poor sexual life. So getting good sleep, tackling into your sleep pillar and sleeping well, creating an environment where you recover and all your hormones recover and your cortisol peaks are where they are supposed to be in the 24-hour period. Thanks to your sleep, you put yourself in a state of balance. And with that as a foundation, you can start building up into this desire, a perfect desire. You start building up in calling back the libido that you feel that you lost, because that thing, that myth that libido and sex is like high heels, you leave them behind after your 30s. It's not true. It should be as fun and as accessible at our age right now as it was when we were younger. And our libido and our sexual desire are not there only for reproduction. They're as part of our well-being and our good mindset. Exercising has been proven improvements in sexual health and good nutrition. It's been proven as well that an inflammatory state out of bad nutrition or any other chronic disease will tap into your drive and it will influence negatively your libido. So again, all the pillars of lifestyle are there, including substances like alcohol and other substance and another factor that it has a lot of science behind on how will worsen our sexual behavior. Now it is about communication, how we communicate with our partner, and even how do we communicate with our therapist, and we are open to understand that this is part of our physiology. It's our sexual health. So an open communication with the help of a sexual therapist, it's always highly recommended, or someone that has knowledge and experience on how to navigate through problems in a couple. That will help to ignite again your flame. From the hormonal, so we go back into the genitourinary syndrome, just hormonal replacement in general. Estrogens, they do act at the level of your brain, and it can improve your sexual life, but mainly the testosterone replacement is the only indication that the FDA has approved for use of testosterone in women is hypoactive sexual disorder, and it increased libido. Obviously, it has specific indications for it, but all this to say that we have a lot of resources and tools out there that allow us to go back into the stage of enjoying and looking forward, and not thinking that we might just be, that it's a waste of time, or that what for at this stage in life. I would say let's take advantage. If most of you guys have kids that are already going to college, so slowly you're going to be empty nesters, or you're right now after a divorce and you're interested to start dating, like in the animal kingdom, when women are in the process of dating and they are with high sexual desire, they look better because they smell hormones, they smell, oh my God, this woman is just smelling hormones. The estrogen makes our skin beautiful and radiant, and the way we walk and our brain is there, and we feel so assertive. So we balance our hormones and we can put ourselves out there again and looking good. Self-esteem is going to play an important role. We're going to regain our self-esteem as well. And that lingerie, by all means, go to Victoria's Secret and pamper yourself and get yourself a nice piece. It is important. Mind and body and even the soul is included. Well, now that I gave you all these tips and pointers on how to regain your sexual life, I also remind you that all this is to empower you and to remind you that your perimenopause and menopause transition, it is a period for blossoming. It is the renewal years. The Japanese culture called these the konenki, the renewal years. So this concludes my episode on my series on Menopause, and I'll see you next in Double Down with Dr. D.
Thank you for listening to the Double Down podcast with Dr. D. If today's episode inspired, empowered, or gave you a fresh perspective, please don't keep it a secret. Subscribe, leave a review, and share it with someone who's ready to take their health to the next level. Stay inspired, stay committed, and I'll see you next time.